The Rwanda Biomedical Center is the recipient of the inaugural Courage to Care Award from ICAP, a global health organization based at Columbia University Mailman School of Public Health. This award recognizes heroes on the front lines who have shown exemplary commitment to care and resilience in the COVID-19 response. This evening, Dr. Saben Sanzimana, the Director General of the Rwanda Biomedical Center, shed more light about this award. Well, first of all, congratulations are in order to the Rwanda Biomedical Center and the government of Rwanda in general. Could you tell us, what could you tell us about this award?
Well, first of all, I mean, this is a work done by so many people. Still, the work is not yet finished. But the recognition from University of Columbia, ICAP, that came to Rwanda Biomedical Center and to all frontliners, the entire government efforts in the fight against COVID-19 is a message that what the investment in the efforts and the resilience of the people of Rwanda is recognized and seen by people across the different angles of the world. And to us, it's not that we've done everything and it's time to relax, but it's more an encouragement. And this virus has shown how we are close to each other from countries. It started from a continent and now have reached the world. So the award is just a symbol that we are one world and this virus is our enemy. We have to fight all together. And the efforts of people in Rwanda being recognized is a good thing and is an encouragement to continue even better.
Absolutely. It being the inaugural award, Rwanda Biomedical Center being the inaugural recipient of this award, what's the criteria? What did they consider for Rwanda Biomedical Center to be the recipient?
Well, what we know so far is that all countries of the world have been actually nominating different people and institutions. So for us, we didn't even know until 2 days ago when this was announced. And we told one of the criteria were actually the our response and statistics that are being shown different platforms from what has been done here in Rwanda, but also how public health measures were implemented. In addition, technology and how we've been adapting to what we learned from the science. Briefly, this is what has been announced this afternoon, and we're happy to have it, and we're very humbled and honored to be part of this fight. Of course, being a country and also being a team that we continue to do our best to fight this virus.
Certainly good news. And on that note, what does this mean for the COVID-19 response in the country?
It means that the virus is still here and we have to continue to fight it until we reach a point where we don't have people who are getting it or who are dying from it, but we are far from there. I expect many more tools to fight this virus, including the vaccine that is expected, but it's not going to stop all we do to keep our country safe from this pandemic and maybe future pandemics also that may affect us. So we didn't do that to get an award, but we do it because it's important and because we need to protect our people, but also protect others in other countries. It's not about actually frontiers of a country. It's not about a continent. It's something for the world. That's why this award from New York and to Rwanda with all these distances means that connection, that we are close to each other than we were before, and this is what we are learning from this pandemic.
As you say, the pandemic continues, and briefly, how are you prepared to continue containing this pandemic, especially with the recent spike, you could say, in numbers in the refugee camps where we had never registered such numbers?
this is the thing with this virus. You can't say that you've done everything until you get the next day and check the new statistics. You've seen the past 2 weeks we were having fewer cases, and we continue to do testing and actually surveillance and research until yesterday. We also discovered that actually the virus is not just gone, is still here. It can emerge. It can be found in any group, in any district. So we need to continue to be focused and do different types of innovations in the fight against COVID-19 until we say we are over it. But we know the virus is here. It's around us. It's just a matter of finding where exactly, which cluster, and how we contain it quickly. And that is what defined the response. And the preparedness has been there before, but as we move on, it's more of finding the virus and containing it before it spreads and affects lives of people.
Absolutely. Thank you so much, Dr. Saben Sanzimana, for your time this evening. And congratulations once again.
Thank you. It's a shared award for everyone who is working to fight this pandemic.